morning, Dr. Cassis here. So today we're going to talk about diabetes. November is the month of diabetes awareness. We're coming on the end, but it's also the start of holiday season, which for many of us is sort of a free for all in terms of food. So it's a good time to kind of sharpen up our awareness about diabetes and the effects that it can have. So as of July 2017, the CDC reported that there's around 100 million Americans that have either diabetes or pre-diabetes. So we know it's extremely prevalent in the United States, and it causes a lot of damage through the whole body. Today we're going to talk about the damage that it can have to the eye. So the first thing that happens with a diabetic, a lot of times is the prescription will fluctuate. Their glasses prescription will fluctuate. A lot of times it's an increase in nearsightedness, and that can actually be what makes the diagnosis for somebody that has diabetes. There's going to be a large shift in their prescription, or if they are diabetic and their prescription fluctuate a lot, that's an indication that the sugar levels are not well controlled. So that's one way that diabetes affect the vision. The other common way is that let's look to our model here. This is the eye sideways. The front part is the cornea. The colored part is the iris. Inside here is the lens. So a lot of diabetics will have cataracts at an earlier age versus non-diabetic. So we know what happens in a cataract is that the lens gets to be a little bit cloudy or cloudier. The light doesn't go through as well, and then no matter what we do in terms of prescription in the outside of the eye, if the lens is too cloudy, the light's not going to go through. The vision is going to remain blurry until the cataract is removed. So that's the second thing that happens very commonly with diabetes. The cataracts are earlier and they're a little bit more aggressive. The third thing that happens, and the most visually devastating, is if the sugar levels are high or fluctuating a lot, especially the first 5 years of diabetes, what's going to happen is the really small blood vessels in the back of the eye, which are on the retina, will start to leak. So bleed in the back of the retina. That's called diabetic retinopathy, and that's where a lot of the significant vision loss happens. If the sugar levels are high, remain high, or fluctuate a lot, the damage to those blood vessels become pretty significant, and initially you can have just a few little bleeds. If nothing is done or the sugar levels remain high, then it can progress to be really significant, where just the lack of oxygen and having that bad blood stay within that small area is going to cause more traction, blood vessels, scar tissue, retinal detachment, and that's how people go blind from diabetes. So it's important as a diabetic to come in on a yearly visit, get your eyes dilated so we can look all the way in the back of the eye and look for those diabetic changes. And then if we were to find something that is significant, then we refer to a retina person, and there's injection or laser treatment that can be done to sort of stop that progression and try to preserve the sight. So one of the latest technology we added to the office is called an optomap. So what happens in the optomap is it allows us with one picture to go ahead and take the whole back of the eye. So this is actually our tech Kylie. We're looking directly inside her right eye. So this is the optic nerve here, the blood vessels, and with one shot we can go from side to side. So internally, almost from white to white, all the way in the back of your eye where the retina is, and then it enables us to see changes to the blood vessels as subtle as they can be or as far as they can be, and can give us a good indication of your sugar control level. And also it's good for documentation. So if you're having, a good year, the sugar level is good, we have that picture, it's a JPEG image, and then on the following years we can take it again and compare them side by side and make sure that everything is staying nice and healthy to really help the prevention of keeping your retina healthy. The other thing I want to point out that about diabetes, we always ask patients, what is your A1c level? And a lot of patients first don't know, or second, don't really know what it means. So the A1c levels is it's going to be between 6 and hopefully 6.5 if it's good. Above that, it's considered elevated. And so it's an average of the blood sugar level over the last 3 months. So if you come in and you say, well, I'm at about 7.5, what that means, the way to know what your A1c means, it's not exact, but it's a really good indication, is to do times 2 times 10. So if you're telling me your A1c is 7.5 times 2, that's 15, times 10, that's 150. So that means overall, over the last 3 months, your average blood sugar was 150, which is pretty high, because we know we want it 120 or below, which it would be an A1c of 6 or below. So that gives you sort of a good trick to be involved in your care and kind of know how you're doing. When you prick your finger, that's at that moment what the sugar level is. But the A1c is a little more important because it really gives you the overall image of the last 3 months. So keep up your good work and trying to keep your sugar low and controlled, and stay strong through the holiday. Make good choices. So I look forward to seeing you in the office.